Welcome to Speaking Holistically, the podcast that explores the power of alternative medicine, natural healing, and homeopathic solutions to help you achieve true wellness. Each week, Dr. Jen and Amy G dive into the world of holistic health, discussing researched, time-tested remedies with expert insights from Dr. Jen, as well as real-life stories from patients to empower you to take charge of your health. So if you're ready to embrace a more natural path to wellness, let's start speaking holistically, because true healing begins from within. Hi, everybody. Welcome to Speaking Holistically. I'm your co-host, Amy G. I'm here with my amazing co-host, Dr. Jen. And today we're doing a Family Health Hub episode on radiation exposure from medical scans. And I know there's a lot of different types. The first one we're going to talk about is mammograms.
So we're actually going to kind of lump them all together, but we will touch on some of them because of the research that's out there. But basically, anytime you have any kind of radiation exposure, it does increase your risk of cancer. I've had dentists say, oh no, it's so minimal. It's less than if you were flying in a plane. I'm like, well, why would I want to compound my exposure? So if the risks don't outweigh the benefits, then fine, let's go ahead and do that. But if you're just doing this as a repetitive routine, then obviously they probably aren't as necessary. Women don't realize how much radiation exposure is happening to their sensitive breast tissue and how you doing that over and over and over can increase your risk of breast cancer. And they've even stated that there's some women who will probably die from the exposure, but it's worth it because they saved so many other people. And I'm thinking, well, unless it's you, that could be an issue. So my grandmother had breast cancer and died from a metastasis from it. She had plenty of mammograms. She had plenty of every scan possible, but she was in that risk category. And I'm trying not to put myself in that risk category so that I don't have to be exposed to the radiation of mammograms. I do thermograms on a semi-regular basis just to make sure that the inflammation stays low. If at some point I decide to do a mammogram, then I might, but I generally will never say never, but at this point, it's not where I'm headed. So, and I'm not saying for the people who've had them, don't ever do that. I'm not going to say that. But at the end of the day, if you have no family history of breast cancer and you're doing mammograms every single year, you may want to kind of start looking at that research a little bit more in depth.
Can we talk just for a minute about, before you go on, I'm sorry to interrupt, but to explain to our audience what thermograms are, because I'm sure a lot of women don't know.
So it's a scan and it will not be covered by your insurance because you can actually detect potential cancer issues 7 to 10 years before they will on a mammogram. So you can actually you can see heat. Basically, you're checking for heat. So if you've got an inflammatory response in the body, and I've had plenty of women who have them, there's some heat signature on there and you can see where it's coming from or where it's going to. So I've had women where their thyroid lights up, but all the tests are looking normal, but the thyroid's lit up, and then you can see, arterial inflammation down into maybe the areola, but they're not coming up with anything, and they do go get an ultrasound, they do go get a thermogram, and they're like, nope, you're fine. And I'm like, not fine. So I would say that you could do both, or you could choose to do the thermogram and then decide what you wanted to do from there. So we'll do supplements, we'll do dry brushing, we'll do saunas, we'll do whatever we need to do for each individual patient. And then I'll have them go and get another one done in a year or 3 years or whatever it is, depending on the person, depending on what it looks like to me, all that kind of stuff. So mine was 5 years in between. And I went back and I had 0 heat signatures, and I was like, perfect. So we're definitely going in the right direction. So at least I know what I'm doing is beneficial by decreasing that inflammation in my breast tissue, and which will leave me maybe not ever having to do a mammogram. Or if I do, then I do one instead of 30 of them over my lifetime,
Mm-hmm.
Yeah, so it's just looking at heat, and you can look up breast thermograms online. There's probably plenty of people in your area that do them. I generally tell people if you can do it from your thyroid down to your pubic bone, sometimes it's $50 more, and they run usually around $300. So some of the places will do it for that price, and not just the breast. They'll do the arms, they'll do the hands. So you can definitely shop around because there's plenty of options, but it's not going to break the bank necessarily. When you look at, you don't have to do this every single year. Like I said, I do it every about 5 years at this point. So that being said, thermogram can be a great option. It has absolutely no radiation exposure. And then you can decide what your risk is and how often you might be going in or choose to go in for a mammogram. Is it every year? Is it every 5 years? Is it every 10 years? What do you choose to do based upon maybe that other puzzle piece of doing a thermogram. And I'm not saying replace the mammogram with a thermogram for some people, but other people may not be doing any scanning. So a thermogram is also a really great idea.
I will say one thing about getting thermograms. You do have to do one thing that is, it's uncomfortable for me. I don't know about other women, but you have to take everything off yourself. And you sit for a little while with just your breast exposed, like in the room, and like let everything settle. And it's uncomfortable, even though the person that's doing a thermogram, they've seen 10,000 breasts. Yours are no different, but that's something I do struggle with. I do it because I want to get the
because you got naked in public.
And sitting in a room while the breasts settle and like
because you can't do any exercise prior to. There's no chiropractic adjustments, no acupuncture, no exercise, no deodorant, like all that kind of stuff. You can't do any of that stuff prior to, just to make sure that they're not getting some false positive type situation. And then you do have to sit there for a few minutes, usually with a fan on you to keep the circulating, and not on you to cool the tissue down as artificially, but just to kind of, so you're not sitting there. But the woman that I do the thermograms with, she never looks at me at all. So she looks only at the computer, and she's got the camera pointed away from her. So she never actually ever looks at me. She only looks at the computer. So she's only seeing the computer.
Oh, so that's nice.
Yeah. So it's a lot more comfortable for women who are uncomfortable, obviously exposing themselves. And they do this for a living. They see probably 15 sets of boobs a day. Like they're like, whatever, I think the worst part of getting it done is seeing what you look like without any skin, with maybe a little extra fat around the midsection. You're like, what is that? That's what I look like? I think that's the worst part of getting a thermogram, honestly, is seeing those images going, oh my gosh, because sometimes in our head, we don't look like that. And in clothes, we don't look like that. But then you take that off and there's nothing holding that stuff in, especially if you're getting a scan down to your pubic bone, and they've got you pulled your pants down just enough to get to the pubic bone. And now you've got your love handles lobbing over your pants, like in a totally not natural position. You wouldn't walk around like that. So I think that's the worst part.
Oh my God, that's funny. For me, it's just, I would have been a terrible nudist because I'm like, I don't. Yeah.
And then there's me. I have my kids in a bathtub in my living room and invite all the neighbors. You know what I mean? So
I know. We're so opposite in this way. We're so opposite.
Like, whatever.
All right. I just wanted to tell people that because it's just important. I think it's just important to note, hey, you're going to sit there without your shirt on, with everything hanging out, like your boobs are just on display for a good 5 minutes before they do the thermogram. And if you're not mentally prepared for that, it might be like kind of a shock. So
well, and that's good. I'm glad that you did bring that up, because that is something that you're like, I'm not sure what's going to happen. And I've never had a mammogram. I know what happens because I'm a physician, but at the end of the day, I've never been in there and I don't know what that feels like. But I don't love my breast tissue being smashed. So I'm like, you know what? Yeah. And I don't want the extra radiation. So now I have the mechanical trauma and the radiation trauma. And I'm thinking I'll hold off on that as long as I can for me. And like I said, this isn't going to be the right answer for everybody, but adding thermography into that can be a really beneficial, into that equation can be a really beneficial aspect.
Yeah. And the fact that the 7 to 10 year detection, but prior to mammograms, I don't want to gloss over that, that fact. So
you can see the inflammation and it won't show up on mammogram. And I've had patients where I'm like, listen, I'm coming up with something. I think you should get this checked out. They go get it checked out. They're like, nope, I'm fine. You were wrong. And I was like, okay, great. I'm glad I was wrong. I think you should go back in another 6 months and get another mammogram. And I'm not a mammogram fan, And then they go back 6 months later and voila, something is there. Well, it was there 6 months ago, but the equipment and the sensitivity of those tests are not necessarily sensitive enough to do what I feel like they need to do. So that's why I said adding a thermogram in is no radiation. And it's another piece of the puzzle that can be helpful information.
I was just going to ask, what about CT scans?
So it's interesting because there's some new research that just came out. It's on PubMed, and it's from the Journal of American Medical Association of Internal Medicine, and it's April 14th, 2025. If you want the PMID, it's 40227719, and we'll put it down below as well. But it's really interesting because they looked at the research. It was, basically like a retrospective study is kind of what they've done. But approximately 93 million CT examinations are performed on 62 million patients annually in the United States. And so we know that the ionizing radiation from CT is a known carcinogen. That's literally exactly the way it starts, okay? So this was from 2023 that they were looking at, and they came up that the study found that this would result in 103,000 future cancers over the course of a lifetime of the exposed patients. So those CTs are going to cause 103,000 cancers because of it. So it basically could account for 5% of all new cancer diagnoses. So that's why I'm not saying don't ever do a CT, but if they're like, well, we should probably just do a CT to check, like, how good is your insurance? That would be the first thing I would ask, right? Is it going to pay for it? Of course it is. So they're going to do it. If you had no insurance, would they still do a CT? So those are the questions that you need to ask, like, and I'm not saying that it's for the money. There are some people who are actually doing it because you need it, but weigh those risks versus those potential benefits. So the most common adult cancers include lung cancer, colon cancer, leukemia, as well as thyroid, lung, and breast cancer were the most frequently projected cancers in children. So for the children, it was thyroid, lung, and breast for this upcoming generation who'd been exposed to CT scans. So just those CTs in 2023 would account for 5% of new cancer diagnoses, annually, basically.
God.
So, and like I said, I'm not saying don't ever do a CT, but I had a patient leaving my office. She was driving back to the freeway, and she was rear-ended from behind at 5 miles an hour. And they took her to the hospital, and they did a CT because she had great insurance.
Boy.
And people go, well, I mean, how much radiation? And so let me explain this, okay? A CT scan typically exposes patients to a radiation dose equivalent to, you ready for this? 100 to 800 chest x-rays.
What?
One CT, just depending on where it is and what the exposure is for the body part. So somewhere between 100, you would have the same radiation as having 100 chest x-rays or up to 800 chest x-rays. That's how much radiation exposure. So people go, oh, well, I just had a CT today. And I'm like, I don't think you understand what you just did to your body.
Oh my God.
So that's something that people need to look at, and they don't know this, which is why we're talking about this, right? So that you can make those choices for yourself.
Yeah.
So the next question I get is, well, then what would I do about it? I was like, well, here we go. So I usually treat patients a week before any radiation that we know that they're going to be exposed to, and 2 weeks after, and double or triple up on the day of the actual radiation exposure.
That makes sense, yeah.
So one thing that I do is we'll use chlorella. There's a bunch of different kinds, well, not kinds, but
there you go, I can see it, yeah.
There you go.
Yeah.
Of chlorella, and we'll do about 2,000 milligrams a day of that per person, like whatever. The day of the CT or the X-ray or whatever it is, the PET scan, mammogram, will go up to 4,000 to 6,000 milligrams of chlorella.
Wow.
So that can be a good option. We also have this other product at our office called Envirotoxin. It has garlic, alpha lipoic acid, chlorella, cilantro, methionine, malic acid, and acetylcysteine, vitamin C, and zinc. So this is a comprehensive support for kind of really any kind of environmental type toxins that you get exposed to help your body deal with it. A Standard Process also has a product called Chelico. And so like for natural chelation type aspects of things. So this can be really good. Garlic obviously is a good detoxifier because it's high in sulfur. So it helps to support the liver detox pathways. Now, after doing that, very often we will add a binder, whether it's charcoal, whether it's zeolite, whatever it is for that person. We test everything. We'll do that a couple of hours after each dose of this, or depending on what they need, once later on in the day, that sort of a thing. Not at bedtime, but like prior to that, so that it can bind to whatever toxins are being dumped out of the system. There's also a homeopathic called Radialgan, and it is from Professional Formulas, and it's a homeopathic. So that also helps with radiation exposure, or it can, let's put it that way, and help support the body that way. So definitely plenty of options for exposure. If you don't know you're going to get exposed, then I would start it immediately. If you know you're going to be exposed, prepare your body beforehand if possible, and try to minimize any exposure you can, because it is compounding. So you fly, you get dental x-rays, you go get an arm x-ray, you get a CT of this, like you get a mammogram, like this stuff definitely compounds. And it's no secret least not to me, that it does increase cancer,
Risk.
for sure.
What about PET scans?
PET scans are high in radiation as well. And not only that, but then they do inject radioactive dye directly into your body on top of that radiation, right? So one thing I do with that is give people higher doses of iodine to really like flood the thyroid and the other tissues that need it. The breasts are also one of those tissues that use a lot of iodine.
Yeah.
But especially that, I mean, I'll give therapeutic doses. I mean, it's short term, so it's not gonna, somebody's not gonna have 50 milligrams of iodine every day for 17 years. It's like we're doing this short term so that the thyroid just uptakes all of it, so that when that radioactive iodine gets injected, it's like, oh geez, you're all full. You know what I mean? So that's what we want to do. So it doesn't just like, oh, perfect. That's exactly where we wanted it to lodge and stay and bind.
Wow. And x-rays, obviously the most common x-rays, what those are?
It just depends because, the radiation exposure is different. And it also depends on the x-ray tech. I mean, I see x-rays all the time where some of them are beautiful and some of them are seriously overexposed. So there is definitely way too much radiation exposure for that body part, the size of the person, that sort of a thing. So, yeah. So if your x-rays are more washed out, you know that there was more radiation exposure generally. So, yeah. So there's quite a bit going on there too. So, and people are getting dental x-rays every 6 months. And I'm thinking, okay, you're, and it's not like they're just like, oh, we're just doing your teeth. Like your whole head and brain is being exposed to this.
Yeah.
And there's some dentists who are like, no, you can't come in unless you get these x-rays. And I'm like, well, you may want to find a different dentist or, maybe sign a waiver or maybe find another dentist, that sort of a thing. Just being aware of that and finding out what your actual risk is for, like, are we doing this because of what? Like I had a patient, I think we just interviewed her and her daughter had some cavities. So they did the x-ray, but of course she was doing all of this kind of stuff of the detoxification aspect of it before the x-rays. And then we did a bunch of stuff to help heal her cavities. And then she went back 6 months later and had another x-ray done. Well, that's the only way you're going to be able to figure out if it's actually healed, and they were all gone, and it's not the only way. I mean, you can look, but at the end of the day, you're going to see them on film. So once again, she had 2 sets of dental x-rays, which also exposed to the brain in a 6-month period. So, like I said, compounding that with mammograms, PET scans, CTs, x-rays, like weigh the benefits versus the risks, weigh the risks versus the benefits. So that's my biggest takeaway on this. Yeah.
Yeah. Advocate for yourself. Ask yourself, the risk versus benefit question and the insurance question. I love that you said, if I didn't have insurance, would they want to do a CT scan on me right now? I mean,
and my patient who had a fender bender, literally sitting at the train tracks, and they bumped into her and they drug her off to the hospital in an ambulance and did a CT on her. And I'm thinking, for a 5-mile-an-hour rear-ending,
like literally just a fender bender, so minor.
I was like, that's a little excessive. Now you roll your car into an embankment and hit a cement wall or something, then sure, that's probably what you're going to want to do at that point. You know what I mean? But then again, the other person who didn't have the insurance, did they get that same scanning done? I don't know. So like, that's what you got to figure out. Is that accident worth that exposure? Is it worth 800 chest x-rays of radiation?
That's such a shocking fact. Like, it blows my mind. That's just, it's
well, and anything I tell people, I'm like, look it up. Don't believe me. Don't believe me at all. I'd prefer that you didn't. I'd prefer you learn even more on your own. But
educate yourselves. Educate yourselves. Yeah. I do a lot of research for my own family on health matters and holistic options and alternatives to surgery and things like that. And I think they just kind of count on me to do it because they don't want to do it themselves. Part of it is overwhelm. Part of it is not wanting to see the truth or they're going to get scared or whatever, like, oh, and it's like, no, just the facts. Like, you're just looking for answers. It doesn't,
And if you have the information, there is no fear. It just is information. And you're like, okay, now what do I do with that? What decision do I make? And a lot of people don't want to make those decisions because if they have some sort of ramification, if they have some sort of result from it, then they don't want to have to take personal responsibility for making that choice. And I'm the exact opposite. I'm like, give me all the information. I'll make all my own choices because then I'll deal with that. So everybody's a little bit different with how that happens and what they do with that information. But I think informed consent is huge. If you went in there to get a CT and they're like, okay, so the radiation is equivalent to 800 chest x-rays, like how many people would do it?
See, that right there, that's the question right there. Because I think that is going to be an astonishing fact for people to hear. I think they're going to be like, oh my God. I don't think they have any idea. Nobody has any idea because the medical profession, they're not talking about this.
People aren't educated, and even in the public school system, I mean, all the school system, I've always said, like, the one thing we are not forced to learn about is our body. The one thing. We have to do algebra, we have to do geometry, we have to do statistics or calculus or whatever. All this stuff. And then the one thing that we literally have our entire lives, and we never have to learn one thing about it. So you can't even know what questions to ask. And that's the biggest problem is, if you knew what the spleen did, if you knew what the pancreas did, then you'd have better, you know what to ask, but we don't have that information. And with the internet, it's readily available, but at the end of the day, I think it should be the foundation for everything. And every year that information should be built upon. In kindergarten, you learn what your organs are, where they are. And then in first grade, so if we worked on that, it would be not so scary for people because they would know how things work. And when they have a symptom, they'll be like, oh, I wonder if it's this or that, which, most people are great identifiers of their issues. They'll come in to me and I'll listen really, really intently, and they will tell me everything I need to know. And I tell them, well, you live in your body more than I do. So I'm listening to you. Like, if this is what you're feeling and this is your symptom that you're having, let's look at this. And what about this? And that leads me down a path with more questions. But I listen to my patients exclusively because they will literally 99.9% of the time give me all the information I need, just shy of calling it what it is, like giving it a name, and we'll be like, boom, here it is, because they're so aware of their bodies, which is awesome.
Yeah. And I talked about that story recently. So obviously we don't live in the same state, and I have a chiropractor who I go to for my adjustments, and I was going in and I had low back pain. And I thought to myself, I haven't done anything to cause this. It came out of nowhere. And my first thought was, it's my kidneys. So I went in and I said, I think my kidneys are having some trouble. She muscle tested my kidney reflexes on both sides. They were both weak. And she kind of looked shocked. She's like, yeah, you're right. It's your kidneys. I was like, yeah. So I came home and started shoving renotrophin into my system, and boom, that was it. Pain went away. And the next time she tested my reflexes, they were strong. And that's the thing, right? Is just listening to your body and having the knowledge and being aware of what those pain cues are, and being able to go, okay, I think it might be this. But you can't say that unless you do your homework.
Well, and then knowing, like, okay, well, maybe I need a CT, and it's well, maybe you don't. Like, let's take a look at all that and then give you all the information so that you can decide what exposure you want to be exposed to based upon family history, potentially your genetics, if you've had those looked at, past history, how you're treating your body, all that kind of stuff. And all of that makes a huge, huge difference.
Yeah, absolutely. Well, thank you, Dr. Jen. This was a pretty loaded episode. I feel like we're going to get a lot of comments on this one, but it's great though. We need to educate people about these things. And again, if they were asked, hey, we're going to go do a CT, it's equivalent to 800 chest x-rays. Will you do it? Are you okay with that? There'd be a lot less CTs being done. And it's just having the knowledge and understanding, I'm exposing my body to this huge thing, and maybe finding alternatives, or maybe not doing it at all if it's truly not necessary. So very informative. Thank you, Dr. Jen, for your wisdom and knowledge as always. Thanks everybody for listening. If you haven't joined our school community before, I'll put the link in the show notes. You can also follow us on Facebook, Instagram, or subscribe to our YouTube channel. Until next time, everybody. Bye-bye.
That wraps up another episode of Speaking Holistically. Thank you for listening. We hope today's conversation gave you new insights and inspiration to take charge of your health. If you enjoyed this episode and want to hear more, be sure and join the Speaking Holistically school community by clicking the link in the show notes. There, you'll get access to daily podcast episodes, weekly live Q&As, educational content, and so much more. You can also connect with us on our Facebook page, follow us on Instagram, and subscribe to our YouTube channel. Until next time, be well, stay curious, and keep speaking holistically.